Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about from a GED or a high school diploma to a career in medical coding. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so now I talk about a career in medical coding, and the first thing that I want to say is I am not making this video to sell you the field. I will tell you things that are very cool and things that are, I don't know if I could do that. I will tell you because I want people to be prepared. But the main purpose of this message is to say this. If you are young and you're just out of high school, and let's just say you are not ready to go to college yet, and maybe you're considering going the trade school route to just learn a trade and then, get on with your life and then go to college later on. This medical billing and coding, or even medical coding itself, is a great career field. Now, if you don't have a high school diploma and maybe you left high school, because guys, high school is hard. I mean, it's not hard that it's hard to learn. If you have great teachers, that's a good thing. But high school is very difficult, and I can just imagine how difficult it is now that we're in this social media age, right? When I was in high school, there was not the social media age, okay? Social media and the internet was very green still. It was brand new and barely coming out. Like, if you had access to the internet, it was because you were involved with the school or the university and things like that. That's how you were able to get the internet. But other than that, it was just for other purposes, not for social media. So I get it. And sometimes people just don't have it in them to deal with the foolishness that can happen in high school. So they leave high school. And there's nothing wrong with getting a GED. I've said this before in one of my comments. Somebody says that, I didn't finish high school. I said, well, get your GED, And somebody said, well, that's just mean. It's not mean, guys. It's not. Having a GED is just as great as having a high school diploma, because not everybody that finishes high school goes on to do anything with it. Okay? So if you make the conscious effort to go back and get your GED, if you don't have a high school diploma, it's going to open up way more doors for you than just continuing to do what you're doing. Because yes, while there's many entrepreneurial opportunities out there with social media and the internet and everything else, and people are becoming their own bosses, doing their own business, some people don't want to do that. They want to be able to work someplace, and maybe they're working for a place that is not challenging enough for them. So again, going and getting your GED, or even going to one of those programs that offers high school diplomas once you complete it, is still just as good, guys. It's still just as good. But a career in medical billing and coding is a great place to start your life. I mean, if right out of high school, I had a viewer who I am proud to say is a very close personal friend of mine now. But he graduated high school, and he wrote me saying that he had graduated high school. He went to one of those health career focused high schools, like a magnet school, and he took a medical billing and coding course, and then when he graduated, he took his certification, passed, and now he's doing wonderful. I mean, this guy, I expect a lot out of him, but he doesn't even have a college degree. He's never been to college, and he's 20. He just turned 20. He's gonna be 21 this year. But he's doing fantastic, and he's making very good on his salary and everything. Now, we don't talk about money specifics on my channel. Never have, never will, because I feel like this career is great and it pays very well, and you can look at the Department of Labor or the Bureau of Statistics to find out what starting salary is in your area. That's why I never give out exact figures, because everywhere you go is going to be a different starting salary. But let's just say, for this sake, that it is a very comfortable salary. It is more than just what you would make if you were just working a minimum wage job. Okay, it's way better than that. Now, the thing about it is, to get there, you do have to study. Now, this will require you to know about medical terminology, anatomy, pathophysiology. All you need to know to pass your certification, of course, is the basics. This is all you're going to have to know. Now, most programs out there that are for medical billing and coding, they run about $5,000. Now, if you don't have that, it's okay. There are some colleges who do have these programs, and they do take FAFSA and all of that. So if you need to use a student loan, the FAFSA or whatever, to do that, then by all means, you go right ahead. But you don't have to. That's the great thing about this career field, is that you can actually study on your own without having to go to a formal program, and then you can be able to sit for the certification. Now, there's two major medical coding associations. There's the American Health Information Management Association and the American Academy of Professional Coders. Now, my channel, Medical Coding with Blue, is filled with lots of explanation videos about the differences between the two associations. Please take the time to look through the videos, okay? Because if you say, where is it? I won't answer. Because this career field is about doing your research, and I have plenty of resources, okay? The other thing is this. Now, whether you sit for a certification for the American Health Information Management Association or the American Academy of Professional Coders, I do have an independent study video that lists a whole syllabus. These are all the books and all the studies that you're going to need to do while you're training yourself for a career in medical billing and coding. Now, if you've finished high school, or if you're out of high school and you didn't finish, that's okay. Get your GED. I'm telling you, get your GED. And then you can be on your way to this, because you will need to show proof. Some employers will ask you. I've been asked before myself. And so that's the thing. You have to be able to prove that you're either a high school diploma person, that you have your diploma, or you have your GED. Either one, guys. And if you want to do this, you will have one of those, okay? So do that, and then with the independent study video, get those books. And those books I've listed, they're the cheapest possible finds that are out there. You can get your coding manuals. You will need at least 3. There's the ICD-10-CM, that's the diagnosis coding, the CPT, and the HCPCS book if you are learning on the outpatient side. If you are learning on the inpatient side, and again, I will leave the links for those videos explaining the differences between the two. But there's also ICD-10 PCS. But in the description box, I do have the link for the website that I like to use, because they are the best when it comes to these manuals. And when it comes to these manuals, it depends on which manual you get, because all of the manuals are different, and there's different organizations that make these. Optum is the best in my opinion. This is not an ad for Optum, but it is the best in my opinion, because they're full of just helpful tips. You can also use these as looking up the codes, but it's also got some examples throughout the book. So these are great to study with as well. But get those, and they're on sale right now. The 2023s are 85% off. So the ICD-10-CM, the ICD-10 PCS, and the HCPCS book are all around $25. They're like $22, $25, $26, something like that. Maybe $27 each. And then the only expensive book that you will need to get is the CPT book, and that's $107. But it's still cheaper than if you actually paid it out, somewhere else, But it's free shipping on that website. Again, optumcoding.com. That link is in the description box below. And so when you go there and you order your books, that's ordering the first part. Then you got to get your workbooks that you need. Again, they're listed in the description box below. The ICD-10-CM and ICD-10 PCS coding handbook with the answers, and the CPC study guide. Now, just because you get the CPC study guide, it does not mean that you have to take the CPC. The CPC is a certified professional coder. That is an outpatient credential with AAPC. You don't have to take that, but it will prepare you if you want to sit for that one, or if you want to sit for an American Health Information Management Association credential. Okay, but take the time to study that. The syllabus that I have, it will take you 9 months to 12 months if you follow it all the way down. and use the time base there. You know, it'll take you between 9 and 12 months to complete. You can take up to 18 months. That's fine if you feel like, you know, you need a little bit more time to work through the workbooks and things like that. That's okay. And you can still work during this time, guys. You can still work. If you're working, you know, at a convenience store, or if you're working at a restaurant or something like that, you can still work while you are studying for medical billing and coding. And then you can take your certification exam, and then you can go out and you can find your first job. Now, yes, you may hear that it is difficult to find your first job in medical coding. My biggest bit of advice, and I hope you all hear me on this video, stay out of Facebook medical coding groups. They are filled with negative Nellies and vipers and people who have their own personal agendas. This is a career field that will be around despite what fools say. Now, yes, I said fools because there's people that are saying, oh, AI is going to take over and blah, blah, blah. No, they've been threatening AI since I started, and I started in 2008. And don't y'all make a crack about, I wasn't even in high school then. Quiet. But they've been threatening that since 2008, guys. We're still going to be here because the one thing that we have that AI will never have is critical thinking. Okay, so that's the thing I want y'all to keep in mind. It is going to be here. They do need us, but they do need medical coders that are going to do their research, that are going to be studious, that are going to really dig in and find the answers, and that's very important. Okay, so I will say that. Now, it is possible to get a job in medical coding, okay? I went through the temporary agency. It's a temporary agency for medical professionals. That's how I got in, and it is possible for you to get in as well. If I would have known about medical billing and coding when I was just in my in my late teens, I definitely would have gone that route. There's longevity with this career field. There's growth with this career field. It's not just stagnant. You know, once you spend your first 2 years learning the industry, getting in, and really learning what you're supposed to learn, like in a clinic setting, or maybe even in the emergency department, coding for there as well, or an urgent care clinic. Once you get to know your way around, you can always move up to, you know, doing different things, whether it is becoming a lead medical coder, you know, somebody who teaches the new people that come in, or maybe you want to get into clinical documentation improvement. That's later on. I think you need 3 to 5 years for that. That's just my own personal opinion, because that's way different from coding. But that involves education. Educating providers, and so does being a medical coder. That involves that as well. But you know, with CDI, it's just a next level up, and you're looking at clinical indicators and all of those things. So you really do need a little bit more of advanced background on that. But again, there's growth. There's becoming a supervisor. There's, you know, going back and deciding that you want to get your degree. Now, if you do decide to pursue a degree in health information technology or health information management, that's a great stepping stone if you want to get into leadership. You don't want to pursue a degree not knowing what you're getting into because you think you need a degree to make good money. Medical coders make good money with just their certifications. I know, because I've made more than RHITs and RHIAs and even RNs. And I don't have a degree, you know, and so that's the thing, you know, it's just a matter of becoming more involved in medical coding, learning what you can about medical coding and the disease process, and you know how those codes go. And we have to know what doctors know, well, never having gone to medical school. You know, that's how serious it is. And sometimes I joke that, you know, it would have been easier if I would have just went to medical school at this point because I'm still learning, you know. But you know, it's a, like I said, it's a great way to grow as a professional, grow personally. I've grown personally through this career field. I'm a lot different than I was when I first started. And of course my skills have become more enhanced, you know, throughout the years. So That's just the thing that you'll get with this career field. And there's so many things that are just available to us, as time goes on, and becoming involved with the associations and, doing that if you choose to. This is another great way to network and get more opportunities, and fantastic opportunities that you didn't even think were even possible, right? And we communicate a lot with people who are highly intelligent. If you are somebody who values a intelligent conversation, this field is for you. Because when it comes to dealing with these providers have their different attitudes. You can't be intimidated by them, but you have to be respectful to them, okay? Don't let just the fact that they're a doctor intimidate you, because they're people too. They're people just like me and just like you, and they don't like to be scolded. They don't like, those things, but they do like to be communicated with, and they do like to be heard. It's just like how you would like to be heard. They like to be heard as well. There's a lot of times when medical coders will, it'll go to their head that, they can tell a provider, no, you're doing this wrong, you're doing this wrong, you're doing this wrong. But what are you doing as the coding professional to train them? It is your job to train them. And when you take pride in what you do, and when you take pride in the fact that you can help them and support them, they will work with you even better, rather than the person who is a bully and who is just rude and nasty because they can be, And so that's just one thing that I would say is my bit of advice there. But again, if you want to pursue this career field, it's going to take a lot of effort, and it's a lot of persistence, especially with the study part. It's not going to be easy. It will be tough. There will be times when you will question yourself and what are you doing? Why are you doing this? But if you stick with it, you'll see what sticking with it will get you. And it will get you far, because the more that you learn, the better prepared you are, the more opportunities you'll get, especially when you start applying for these jobs and you have to take these assessment tests and things like that. Guys, it's possible. It is possible to do this. And as I said, if I would have known this in my late teens, I definitely would have pursued this, because this is definitely a career field that you can grow with, that you can stay with. People get into this career field all the time from different parts in their life. Some people are right out of high school and don't really know what to do, so they get into medical coding because it pays well, and they end up liking it, and they grow from there. Some people have a whole different career field for 20, 30 years and then retire and then get into medical billing and coding, and they have another full career from this because they enjoy it so much. A lot of people say that there's a puzzle to it. It's a puzzle, and it's true. It is true that it is a puzzle, and you do have to spend time reading. It is a lot of reading, okay? If you don't like to read, this is probably not for you, because it's not a data entry job. A lot of people think erroneously that it's data entry and I don't want to type all day. It's not typing, and if you knew anything, you would know that. It's not typing. It is reading, and it is using, the keypad to be able to put the codes in, but you're using an encoder a lot of times. It's an electronic code book, and sometimes you still have to use your book, okay? But you do have to use your book for the test. That's why I say on my other shows, you do have to know your book. You have to be very familiar with your book. Don't write in your coding books, because a lot of people, they show off their coding books. A lot of students, they will show them off, and they'll say, oh, look at my book. I tabbed and wrote and highlighted, and I'm like, where is the book? Where's the actual book itself? Because it's too much writing. And if you're taking an AHIMA exam, the American Health Information Management Association, you're taking one of their exams, they do not allow excessive writing in their books, okay? So when you go in and take that test, if you have too much writing and you have these homemade tabs, they will not let you take your test. So that's just something that you got to know. AAPC does allow for writing and tapping and stuff like that, but to me, if you're using the book, you won't need writing and tabbing and highlighting. And I don't care if that's how you learn. I don't, because a lot of people will say that, oh, that's just how I learn. You're not using the books as a workbook. They're a reference book. There's a difference between workbook and reference book. Workbooks you can write in all you want to, but these reference books, they need to be trusted. They need to be respected. They need to be looked at and worked with, okay? And that's just what I will say. And they are pretty big, okay? If you see in the background right here, those are just some of the manuals back there that I have. These other two are just some other reference books that I have, but that spiral bound book there you see, that's one of the books. It is big. You do have to work with them, but it is fun once you get into it. But you have to want to get into it because it is a long, difficult road, all right? But the reward is so great. You know, being able to be in a job that pays well and supports you, and you're making more money than you thought, you know, as far as like being right out of high school and just working a minimum wage job. It's better than a minimum wage job, okay? And that's just what I would say about it. But don't get into it for the money, okay, guys? Don't do that, because people who get into this career field for money are often unsatisfied instead of just waiting out, getting that experience, and then taking their experience and their knowledge and know-how and then moving on at a better pace, right? Instead of just hopping from job to job because you're looking for the next big money. No, you have to spend time and learn, and then you can move on. So that way you can move up and do whatever it is that you want to do. But like I said, if you don't have a high school diploma or a GED, get your GED. Just get your GED. It's, you know, with all the studying that you're going to have to be doing for medical coding, you're going to need that GED, guys. You are. Now, you're not going to have to be heavy into math, but you will need to know basic math, plus, minus, multiplication, division math. This is all stuff that you can work out on a calculator, okay? Especially if your first job is in billing. If your first job is in medical billing, then it's a lot of formula math. I mean, it's just literally plugging in numbers, and the formula is already there. So it's not anything to panic about, but it is a great thing to do. It's a great way to start your life and get going, because guys, I don't have to tell y'all that life goes by just like that. And by the time you know it, you're going to be at retirement age, and you're going to be thinking, oh my gosh, what did I do with my life? What did I do with myself? And this is a wonderful alternative to, you don't have to go to college. You don't have to have a degree in order to make good money. You can get a degree later on, and your employer can pay for it, because oftentimes, oh, I want to sneeze. Oftentimes, employers will have tuition assistance. And so why get into student loan debt when you don't have to? Okay? I have always been student loan debt adverse. You know, no. I will pay out for school rather than take a student loan, because I'm not going to sit here and have these people calling me and not be able to do certain things because I still owe student loans. You know what I mean? I won't do it. So if you don't want to do that either, that's great, because again, your employer, if they have that tuition reimbursement as part of their employment package, they can pay for it. Let them pay for it, because it's better for them to have an educated staff than, you know, a non-educated staff, right? So that's just what I'm saying. Be smart. Be smart about it. And you don't have to be one of those people who's fallen into those student loans. I'm just saying. So just be careful, but study on your own. Continue to work. Okay? You can study 20 hours per week. Even though you're working a 40-hour-a-week job, you can still study for 20 hours a week. It is possible. Again, I have a video about it. So with that said, I'm going to go ahead and wrap this one up. But if you choose to go through this field, I think it's going to be great for you, but you have to stick with it. All right? If you say, well, I don't know, I don't like this, this is too much reading and I don't think this is for me, it's okay. Find something and get moving, because that's all you can do, is find something to get moving. Don't overthink, okay? Don't think that you won't like it, you want this, you want that, and then don't listen to all these other naysayers. Do your own research, okay? Do your research and find out what would be best for you, and don't listen to other people. Listen to yourself and your intuition, and that'll guide you. I'm just saying. So with that said, I'm going to wrap this one up. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.